talking about pulse pressure, and after that we will hold class as a TBL. Your absent classmates should join to group A on Monday. I know Monday is your holiday, but because we scheduled today for a TBL and your friend expected for TBL for today, your absent classmates, if they want, they can join to the group A on Monday. Okay? Can you tell this to your other classmates? Okay? So, let's continue this topic and then after that start the TBL. My dear friend, this topic is also important and talking about pulse pressure. Pulse pressure is differences between systolic pressure and diastolic pressure. Normally, what is the pulse pressure? Digital pulse pressure, 40 millimeter of mercury is normal pulse pressure. And pulse pressure is very important. It means that you measure blood systolic and diastolic pressure, you have to calculate in your mind the patient's pulse pressure, because this pulse pressure is showing very important things about that type of disease. So the differences between systolic pressure is normally 120 and diastolic pressure is 80. This is normal pulse pressure as you are seeing. Systolic, diastolic, systolic, diastolic. So, let's think about these two sentences that I want to tell you. Stroke volume. We know stroke volume, yes? Amount of blood volume that goes out of heart during each systole. That is equal to normally 70 milliliters. It's named stroke volume. So, please think about this sentence. Increase in stroke volume, increase pulse pressure. Is it correct?
Yes.
Again, increase in stroke volume, increase pulse pressure. It's obvious. When stroke volume increases, it means that heart is making higher pressure by contraction. Higher pressure, it means higher systolic pressure. Higher systolic pressure will increase, the difference of systole and diastole will be increased, so pulse pressure increases. Yes? So stroke volume increase, it means that heart is making high pressure during systole. The second one involves arterial compliance. We know the definition of compliance, right? Yes. Compliance is capacity. In simple way, is the capacity of any vessels. So, again, think about this sentence. Decrease in arterial compliance, increase pulse pressure. Again, decrease in arterial compliance, increase pulse pressure. Is it correct? Why? Can you explain? Such as arteriosclerosis? It means volume decrease, yes? Yes. The compliance decrease, it means volume decrease. Decreasing in volume, we have inverse relation with pressure. Volume decrease, pressure increase. Pressure increase, it means systolic pressure increase. So the pulse pressure will be increased. What do you think about pulse pressure and resistance? What is the relation between pulse pressure and resistance?
When the resistance increases, the blood flow decrease, so the pressure increases.
Who said indirect? Why?
Because when the blood pressure increases, blood flow decreases, so increase resistance increases.
Increasing, you mean when the resistance increase, pulse pressure decrease?
Because blood flow pressure
Because we have the opposite relationship between the flow and resistance. For example, when the resistance is increased, the blood flow is decreasing.
when the blood flow increases, the pressure constantly, so increase.
When we said some vessels resistance increase, it means that compliance decrease. Again, when we said some vessels resistance increase, the compliance will be, it means it's reduced, decrease. Yes, compliance and resistance inversely proportional with each other. Yes, so based on this, the increasing resistance will increase pulse pressure. I know all of this definition needs to think about it, and I ask you to review it and think about it, okay?
Such as the own law, the pressure is increased, the R is
The resistance increased.
Yes.
Based on Ohm's law, the resistance increased,
Yes.
the blood flow trying to reduce,
Yes.
okay? But the blood flow didn't reduce because the cardiac output is the same.
Okay.
Cardiac output is the same. So what happened? The pressure increased, okay? So, my dear friend, let's see 4 types of disease that Dayton books talk about that, and then start together. These are 4 types of disease that affect pulse pressure. And you are seeing normal pulse pressure as 120 into 80 in here. And these are 4 types of disease. One of them is arteriosclerosis. Arteriosclerosis is same type of disease that arterial compliance decrease. Arteriosclerosis, arterio related to arteries, sclerosis, stiffness, hardness, the wall, compliance reduced. So, in the arteriosclerosis, as you are seeing, what happened to systolic pressure? Increase. Why? Because compliance reduced. Because compliance reduced, it means volume reduced. Reducing volume, increased pressure. Yes? The pressure will be increased. And you are seeing that mostly systolic pressure increased in this situation. The next disease is aortic stenosis. Aortic stenosis is blocking aortic valve. Aortic valve cannot open properly. It means that the whole volume of blood cannot pass through the systole from the ventricle into the aorta. So you can think about that. The amount of blood volume that pass through the aortic valve is going to be decreased. So in the aorta, the volume of blood reduces. Yes, the volume of blood that are making pressure in the aorta reduce. So systolic pressure reduce.
It rises slowly.
Yes. As you are seeing, systolic pressure reduce. The next disease, patent ductus arteriosus. Patent ductus arteriosus is a kind of congenital disease. Do you know the meaning of congenital disease?
Yes.
Some abnormalities during embryonic life is happen. And in this type of disease, during embryonic life, we have connection between pulmonary and systemic circulation because in the embryonic life there is no pulmonary ventilation. So the pulmonary and systemic circulation connect with each other. We have 3 points of connection. The first, right and left ventricle connect with a hole with each other. Right and left ventricle. Right and left atrium connect with each other, and aorta and pulmonary artery again connect with each other. So we have 3 points of connection between systemic and pulmonary circulation during embryonic life. After birth, by inspiration by the baby, these connections block. But in this kind of congenital disease, the connection between aorta and pulmonary vein still remain. So please, you think about that. During heart systole, there is a normal amount of blood that goes to the aorta. But because there is a connection between aorta and pulmonary artery, the blood passes through the artery into the pulmonary circulation. So the amount of blood that circulates in the pulmonary circulation is higher than normal. Yes? The amount of blood that circulates in the pulmonary circulation is higher than normal. And the pulmonary vein empty into the which part of the heart? Left ventricle and left atrium. So the amount of blood that empty into the left ventricle during systole is going to be increased. Why? Because the amount of blood which circulates in the pulmonary circulation is high. Because of that movement of blood through that hole from aorta into the pulmonary artery. So, from heart physiology, we know that we have a law named Frank-Starling's law. Do you remember Frank-Starling's law? When the stretch of cardiac muscles increase, the next contraction is going to be increased to sending the whole blood into the aorta and arteries. So next systole is going to be increased. Increasing next systole, it means increasing pressure in the systole and the systolic pressure increase. What about diastolic pressure in this patent ductus? Decrease. Why? Why diastolic pressure decrease in the patent ductus arteriosus? Yes, because I told you that a little amount of blood passing through the aorta into the pulmonary artery. So obviously the volume of blood in the aorta is reduced, so the systole is reduced. So systolic pressure that related to the volume of blood reduced too.
I can't see the QRS. So how it is normal?
How it's normal?
Yeah, because it should be at first the Q and the R and the S.
Okay.
So where is QRS?
It's pressure, it's not electrical activity. Okay, so the EKG that you studied, it's talking about electrical activity of heart pacemaker. These are pressure inside the vessels. We are talking about vessels, okay?
we can calculate this. Also,
Calculate.
also radar and indicators.
In the vessels, we have no electrical activity. We have electrical activity only in the heart. Okay? In the vessels, we are talking mostly on the pressure and resistance. Resistance as a component. So the last one, aortic regurgitation. Aortic regurgitation is the type of disease that aortic valves are always open, or it's some inherited disease, aortic valves is absent. Think about that. When aortic valves is absent, during heart systole, the blood goes to the aorta, okay? But during diastole, yes, a little amount of blood, maybe half of them, back from the aorta again into the ventricle, because there is no valve to blocking the backward movement of blood. So again, the volume of blood in the ventricle is going to be increased. Again, by the from Starling's law, higher stretch of the muscles, of the cardiac muscles, cause to higher contraction. So the next systole is higher. But what about the reduced diastole in this case? Here we are talking. What about reduced diastole? Why diastole is reduced?
So the heart push along the blood from the
It's again like patent ductus. The volume of blood is less in the aorta because some of them vacuum. The volume of blood again in the aorta is less, and because of that, the systolic pressure reduced. So between these four types of disease, which one or which of them has highest pulse pressure,
The aortic
regurgitation, and
the
patent ductus arteriosus? Because both increased systole and reduced diastole is seen. Yes? Which type of disease has the lowest pulse pressure? Stenosis, the blocking aorta. Wow.
And the middle is this arteriosus.
Arteriosclerosis.
Yes, it is the middle between them.
Yes, because only it's mostly affected systolic pressure. Okay. Please say after me, arteriosclerosis.
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 Thank you. Patent ductus arteriosus.
Patent ductus arteriosus.
Patent ductus arteriosus.
Patent ductus arteriosus.
Aortic regurgitation.
Aortic regurgitation.
Regurgitation. Aortic regurgitation.
Aortic regurgitation.
Thank you. So, let me show you one question. Can you tell me the answer of this question, my dear friend? Which of them increase pulse pressure?
increased arterial confidence.
Increased compliance or decreased compliance? Decreased compliance. Yes? Increased resistance. I told you increased resistance, it means compliance reduced. Patent ductus arteriosus. Patent ductus, the option D. Obviously, decreased stroke volume is not true. We need to increase the stroke volume. Increased arterial compliance is not true again because we need to decrease compliance or increase resistance. Hemorrhage, it means the total blood volume reduced, so the pressure, all of them reduced. Only the patent ductus. So, what about this one? A 35 years old woman. Visit the physicians. You are seeing blood pressure. You are seeing heart rate. And the physician finds she has aortic regurgitation. Which of these options do you think about pulse pressure, systolic pressure, and stroke volume? Aortic regurgitation is related to absence of aortic valves. Please think about it more. I know you can find that. Think more. Is systolic pressure reduced? Who said B? Who said B? Is systolic pressure reduced? You have a digit, 160. What is normal systolic pressure? 120. Why is stroke volume reduced in the aortic regurgitation? What happened during aortic regurgitation? No, absence of aortic valves. It's against. Aortic stenosis is blocking. It's absence of aortic valves. A. All of you agree with A? Pulse pressure increase. You can measure 160 minus 75. The systolic pressure you are seeing, it's so obvious, 160. So obvious it's more than 120. And stroke volume is, you should find it because they said they have aortic regurgitation. Aortic regurgitation, it means the aortic valve is always open. When blood during systole goes to the aorta, again back to the ventricle. So volume of blood in the ventricle is always higher. So always the heart are pushing high volume of blood, it means high stroke volume. Isn't it easy?
No, it is not. It is not.
It's not easy? This is so easy. This stroke volume is related to aortic regurgitation. Okay? This one. A 60 years old man go to the doctor, blood pressure, mean blood pressure. My dear friend, first let me tell you, mean blood pressure is 130. What is mean blood pressure in normal people? 100. Mean of 120 and 80. It's 100. So mean blood pressure is 130. And heart rate is 78, cholesterol is high, and have an arteriosclerosis. Which of these options do you think related to this patient? this switch is for what? B. All of you agree with B? Pulse pressure increase because of arteriosclerosis and because of high mean pressure, high mean arterial pressure, we can say pulse pressure is high. Arterial compliance, again, when somebody has a arteriosclerosis, it means compliance reduced, yes? And finally, systolic pressure. Why you think systolic pressure is high?
Because the amount of blood sac or
No, the amount of, not the amount of blood. Because because the elasticity and compliance decrease, so the systolic pressure increase.
what about the
D. Systolic pressure, you said it's decrease. Why?
the amount of blood
The amount of blood.
is different
Why?
because it is during pulmonary artery.
It's arteriosclerosis. It's not patent ductus. Okay? Put that name, patent ductus arteriosus. Mostly said patent ductus. It's arteriosclerosis. Sclerosis, it means stiffness, hardness of wall. Okay? Any question? So let's start TBL class. At first, let's review this simple question. Which organ has the most blood flow in comparison to its weight?
The kidney.
Kidney. Total cyanide poisoning of oxygen can cause local blood flow to increase or decrease? Increase. Increase. Cyanide poisoning of oxygen can cause local blood flow to increase. What's the role of endothelin? Endothelin is produced by endothelial cells. What's the role of endothelin? Vasodilation or vasoconstriction? Vasoconstriction. Which cell could release endothelin? Endothelial cells. Can you tell me 4 endothelial growth factors in the chapter 17 they mentioned? Excellent. Yes. Platelet, PDGF. FGF, the same, fibroblast. No. The fourth endothelial growth factor. Come on, you told me you studied. FGF, VEGF, PDGF, angiogen. Can you tell 2 anti-angiogenic factors? 2 anti-angiogenic factors. are angiogenic factor. I'm talking about anti-angiogenic factors. Two anti-angiogenic factors. Yes, thank you. Which iron can increase vasoconstriction? Calcium. Excellent. So, do you have groups by yourself? Okay. Please sit by your groups and try to answer this first question. I will send a link to write your answers on the link. Okay?
Doctor, from who you send it?
I will send it. Dr. Tayeba is not here.
Not here. You want to send to me?
Okay.
Can you give me your...
Okay, let me at first find it and I will send it to you, okay?